In less than a month, an integral part of the National Suicide Prevention Hotline shuts down. The Trump administration says it is getting rid of services specifically for LGBTQ youth who call 988. Jennifer Hoff has more on the reasons why and what happens next. Jennifer?
Lauren, the feds have stood firm in this, saying that it's still providing the same amount of 988 services and government funding as years past, focusing more on serving everyone who needs help. That's despite, though, President Trump signing legislation his first term requiring 988 provide specially trained staff for LGBTQ youth, acknowledging that they're at a much greater risk of suicide. Nearly 3 years ago, what was the Suicide and Crisis Lifeline made a big shift, implementing 988 instead to make it easier for people to contact. A demand doctors say keeps growing.
I think dialogue's very different than it used to be. And I think we're doing a much better job of honoring crises, honoring mental well-being.
Dr. Josh Stein is a longtime psychiatrist working with children as young as 5, advocating for more supports as the Trump administration dismantles one of them.
I was strikingly saddened by it.
The Department of Health and Human Services budget eliminating 988 funding for specific LGBTQ counseling come July 17th. The Office of Management and Budget writing in part it wouldn't grant funding to a chat service where children are encouraged to embrace radical gender ideology by counselors. This, as statistics show, LGBTQ youth are 4 times more likely to contemplate suicide.
That has real value for them to reach out and connect with somebody that can hear them and see them and understand the unique process that they're going through. It's very challenging when the politics can start to get in the way of best treatment and best practices.
Data shows this service has already helped 1.3 million people, a now sunsetting specialized resource as Stein keeps working to help people heal and bring them together.
There's a lot of vilification of the other right now, but when most people sit down in a room together, there's a lot more they share in common, and my goal would be to get people back to that.
So again, 988 services not being terminated, and there are 6 more national centers dedicated to LGBTQ youth. We also posted a full list of other mental health resources right here in Minnesota that you can find on KARE11.com if you or somebody you know might need some help.
Yeah, important that those resources are there for people.
There's still a lot out there for folks who might need it.
All right, Jennifer, thank you. Yep.